Kasirye. Good afternoon.
Good afternoon, Mr. Chair and members of the board. I have a very brief update. We did send you some information, and I just wanted to highlight a few things. One is, I believe the last time you did ask us about when the state of emergency was ending, and it sounds like they heard you and sent us an update. So the state will end the state of emergency on February the 28th, 2023, and the federal government is scheduled to end it on January 11th, 2023, unless they change it. Part of the reason for not doing it right away, because one of the questions we've been asked is, well, the levels are low right now, so why isn't it ending, is that both the federal and the state emergencies actually came with multiple waivers. Some of those waivers were for eligibility for Medi-Cal, so they made it easier for people to actually be able to get onto Medi-Cal. There are also waivers for testing and vaccination and waivers for liability, and also for licensing. There are a lot of additional licensed groups that were allowed to be able to provide vaccination in order to increase the number of places where people could get vaccinated. So all of those, right now what the state is doing is going through all the waivers and finding out which ones they would like to be able to continue and find ways of being able to continue that. So this additional time allows them to do that. The other main reason also is we are going into a flu season. And I think you're all very aware that the last couple of years, the flu season has been mild, and partly because either we've had restrictions with lockdowns or we've had masking. So this is the first year where we are not going to have those restrictions in place. And so, of course, there is some concern about what the numbers are going to look like with the flu. And then there's also a virus called the respiratory syncytial virus, which can cause very severe disease in children. And then, of course, we also still have COVID, and Omicron is still producing subvariants. So, of course, there's a question about what that's going to look like. And you've probably heard in the news talking about a triple pandemic or something to that effect. And that's what they're talking about, is a concern that we're going to have all of these three viruses circulating. And so one of the questions that a lot of our partners have asked is, what can they do to protect themselves? And so just wanted to quickly remind people that some of the ways to avoid getting sick and avoid getting any of these, and all of them are respiratory viruses, is one, we do have vaccine for COVID, and we have vaccine for the flu. So make sure that if you've been vaccinated before, you're up to date with your booster. We now have a bivalent booster that can protect against the Omicron. The other is, and also the flu vaccine is out now, so please make sure that you're up to date on those two. Of course, especially for people that have conditions that put them at risk, making a risk assessment when going into places where there is an increased risk, for example, closed spaces, crowded places, or close contact. We've been hearing a lot about the airport. It's going to be very busy with holidays coming up. And so people do need to think about that if they are going to fly. If they do have to fly, or if they have to be in a crowded place, masking is still a very good option. It is voluntary, but highly recommended, especially for people that have conditions that put them at risk. And for people that do have symptoms, to stay home, and if they do have severe symptoms, to seek medical care. So, of course, we're watching to see what's going to happen over this flu season. We're hoping it will stay mild, but definitely we'll be on the ready if we need to ramp up with more vaccinations. And if everything remains the same, then the expectation is that we'll have the emergencies ending at the beginning of the next year. And we've had a discussion with OES partners, and we plan to also end the county state of emergency for COVID at the same time that the state ends theirs. So that's the end of my comments. So I don't know if you have any questions for me.
Okay, thank you, Dr. Kasirye. So go to board members, see if there's any. Yes, Supervisor Frost.
Thank you, Chair. I am, in the last couple of weeks, there are some events that have taken place. Our legislature has approved a law that basically does not allow medical doctors to speak out against COVID, or they risk fines, or they risk losing their license. I think that's concerning when our medical community is no longer able to practice medicine. I'm also extremely concerned that the FDA and CDC are mandating, that we're mandating or heading toward mandating a childhood vaccine in order for our children to be in schools. And I feel like I can't not say something about that, because children do not get COVID, so why do they need to have an experimental mRNA shot in order to go to school when they don't get COVID? I think it's concerning. There's a catastrophic report of all kinds of adverse reactions in VAERS to this shot, and everything from heart attacks, arrhythmias, strokes, reproductive problems, loss of pregnancy. There are people that are in their 80s who are bleeding, reproductive bleeding. It's just neurologic reactions. We don't know how this will play out, and COVID is gone, and we've had all these other I guess what we're calling viruses. We don't really know what's causing it. I don't feel like I, in good conscience, can just not say anything about this. And so I'm just here to go on record that I believe in freedom of choice. You know, I believe if people want to get the shot, that's fine. But to give a shot to our children who do not get COVID and die from COVID, to give an experimental shot to them just is not right, and I cannot condone it, and I do not support it personally. So I feel compelled to go on record, and I think even if we do end the COVID pandemic, are we going to end the vaccine, or are we going to continue being in the vaccine sales business? The CDC and the FDA are not medical doctors. So now our medical doctors can no longer have an opinion, but a government agency that's not elected can instruct our whole Western medical allopathic system. So it's a statement, it's not a question. I just wanted to go on record as making that statement that we should wake up and try to see that there's something wrong here. Thank you.
May I respond, please?
Sure.
Can I ask a question first, because it might help the doctor respond?
Sure.
So Supervisor Frost felt compelled to say what she just said, so I feel very compelled to say or ask the questions I'm going to ask of Dr. Kasirye, because I'm compelled to make sure that we don't spread misinformation. The first statement she said is, children don't get COVID. So Dr. Kasirye, is that true?
Children do get COVID, and some of them do get very severe disease. We have had a few deaths as well.
Okay, so the answer is another one of my questions, which is, do children die from COVID?
Yes, they can.
One of her statements is, COVID is gone. Is COVID gone?
We have low levels of COVID, but the virus is still circulating, and we're still getting cases reported daily.
Okay, and then how about the CDC aren't medical doctors. Are there medical doctors that advise or work with the Centers for Disease Control?
The CDC and FDA have multiple doctors, many of them very highly regarded, and they're the ones who are providing the guidance that we are following.
And then lastly, I've asked this question of you many times. I'll ask it again because it's warranted here. Are you a medical doctor?
Yes, I am.
So the answers to the questions I just asked to clarify what I took as great misinformation is coming from a medical doctor's perspective. So thank you, Mr. Chair. I just want to make that point.
Thank you, Mr. Cerna. Before I go back to Supervisor Frost, did you want to weigh in?
No, I don't have anything further. I was going to clarify a few things.
Okay.
Actually, I do have one thing to clarify, apart from what Supervisor Cerna said, and that is that the COVID vaccine was not added to the number of vaccines that are required for children to go to school. I know that there was a proposal from the governor when the vaccine first came out, but they decided to wait on that, so it is not added. It is voluntary right now for children to get vaccinated. We do advise and definitely encourage parents to consider it, and many of them have gotten the vaccine, but it is not one of the required vaccines.
Okay, thanks, Dr. Kasirye. Supervisor Frost.
I'd just like to say that statistically 0.0027 of children are statistically listed as having died from COVID. That's essentially a statistical zero. And I'd also like to add that early on, and I think it was in March or April of 2020, the CDC handed down a directive that hospitals could determine someone had COVID if they had the respiratory symptoms without getting a test or proving that they had COVID. So the statistics that we have collected that the CDC seems to be handing out are difficult to really understand, because if doctors are just using, in their opinion, someone has, a respiratory distress, so therefore they have COVID, and that hospital can receive added, money for COVID patients through the government. It kind of skews the statistics. And so it's difficult to really understand what the real statistics are. But if you just want to go to statistics, if you just look at year over year, all-cause deaths, the all-cause deaths increased drastically by 40% after the vaccine campaign started. So I think it's important to be aware and to I don't understand why all of a sudden the only treatment for everything is a vaccine. I'm not anti-vaccine. I had all my vaccines. My last vaccine was in the summer of 2020. But, children don't die from COVID. That very few have died from COVID. So giving them an experimental shot, mRNA shot, that we don't know what's in it. We don't have the literature. They're telling us Comirnaty is approved, but Comirnaty is not distributed in the United States, and we do not have the literature. We're still getting the emergency use authorization, which falls under a different liability shield, and there is no liability for the vaccine companies. So when parents line their kids up to get a shot, they may find that they wish they had some recourse, and they may not have it. So I know you think it's misinformation. I'm glad we still have.
It's misinformation.
I'm glad we still have a country where we can have an opinion and respectfully disagree, and I thank you for that.
Okay. All right. Any other member of the board? Okay. Dr. Kasirye, anything else?
I'd just like to say again that the doctors that are working on COVID are doing this because they care for the people. None of us is in this for the money. And I know a lot of the doctors who've worked long hours, not even getting paid for the work that they were doing. And I just want to acknowledge the work that they have done in making sure that people are safe. And COVID is real. It has killed a lot of people, including a lot of people that we know ourselves. And so we're continuing to do the job that we need to do. And as far as statistics, I have provided statistics here. We have very good epidemiologists that are working on this, that are keeping up the dashboard. And if you would like, I can again present the information to you of what the numbers look like as far as COVID, as far as the deaths. This is all information I have presented before, and I thank you again for giving me the time to give you this update. Thank you.
Thank you, Dr. Kasirye, and thank you for your regular reporting to this board, and certainly many, many times you've appeared over the course of nearly 3 years now on this and certainly related matters on numerous occasions. So appreciate that. Certainly the efforts of public health staff and folks that have worked very diligently to, as you said, to hopefully keep the community safe, but to be responsive to a variety of changes that have occurred along the way. And obviously we continue to be under emergency orders, but I think as you noted, come early part of next year, hopefully we'll be beyond it, not just with the emergency order, but also with having this all in the rearview mirror. So again, thank you for your work. Do we have any callers on this? I have no one in chambers. And so unless there's any other board comments, that's a receive and file. And again, we thank Dr. Kasirye and her staff for being here today. Okay, with that then, let's continue to move into our afternoon agenda.